Welcome everyone to our panel discussion on role of genomics and big data in reshaping public health policy. Before we start, I'm joining you from Ottawa, and before I begin, I wish to acknowledge that I am on the traditional unceded territory of the Algonquin and Anishinaabe people. This session is jointly organized by CGEN and Genome Canada. CGEN is a federally funded national platform for genome sequencing and analysis. Established in 2014, CGEN employs over 200 staff and is funded primarily by Canada Foundation for Innovation through its Major Science Initiative Fund, leveraging investments from Genome Canada and other stakeholders. CGEN operates as an integrated national platform with nodes in Toronto, Montreal, and Vancouver, supporting and enabling research in key sectors of national importance, including health, agriculture, environment, and many other disciplines of interest to Canadians. Genome Canada, who are our co-organizers, is a nonprofit organization funded by the Government of Canada. Genome Canada acts as a catalyst for developing and applying genomics and genomics-based technologies to create economic and social benefits for Canadians by connecting ideas and people across public and private sector, investing in large-scale science and technology projects, helping translate discoveries into solutions across multiple sectors, including health, agriculture, and agri-food, forestry, fisheries and aquaculture, environment, and energy and mining. With those introductions, I'd like to move on to us. So my name is Naveed Aziz. I am currently serving as the Chief Executive Officer of CGEN. I have spent the last 20 years working within the field of genomics. I'm a geneticist by training, and you can say that I've been involved in genomics since it used to be called genetics. I have been deeply involved in the development of powerful and efficient solutions for big data generation, storage and open source data sharing, which help enable high-speed data exchange at national and international scale. I'm also the current chair of Canada's National COVID-19 Host Genome Sequencing Initiative, or the HostSeq initiative. So we consider ourselves very lucky to have assembled a highly knowledgeable and internationally esteemed group of panelists for our discussion, who I'd like to briefly introduce right now. Dr. Jenny Adana is the head of healthcare at World Economic Forum. Jenny has 2 decades of experience working within healthcare system as an internationally recognized expert on genomics and biotechnology. At the World Economic Forum, she sets the strategic directions of the health and healthcare program, including co-creation with partners and stakeholders from industry, government, academia, and civil society. Next, Professor Dame Sue Hill is the Chief Scientific Officer for England. Most recently, Dame Sue has played a major role in the National COVID-19 Response Program, where she's leading the development and validation of new testing technologies and a globally recognized program for whole genome sequencing of SARS-CoV-2. In 2020, Dame Sue was named one of the 80 most influential people in English NHS and health policy. Professor Jan Joly is the research director of Center of Genomics and Policy and an associate professor at the Department of Human Genetics at McGill University. Jan is the current chair of the CanCogen Data Sharing Committee and co-lead of the regulatory and ethics work stream of the Global Alliance for Genomics and Health. In 2017, Jan was named Fellow of the Canadian Academy of Health Sciences. And last but not least, Dr. Carolina Lopez Correa serves as a Chief Scientific Officer at Genome Canada. At Genome Canada, she's taking genomics to the next level by advancing mission-driven initiatives using genomics to solve the most pressing global challenges. Formerly as the Executive Director of Canadian COVID-19 Genomics Network, or CanCogen, Carolina led a $40 million initiative to advance the use of genomics to understand and control COVID-19 pandemic. So with these introductions, and before we listen to our esteemed panelists, I would like to provide some context to our discussion today, very briefly. So in the throne speech delivered just yesterday by the Canada's Governor General, Mary Simon, she said there was work to be done, and I quote, on improving data collection across health systems to inform future decisions and get the best possible result. So in our discussion today, which was very timely, we are addressing how genomics data has directly informed the global public health response to COVID-19, and which challenges exist in the aggregation and sharing of such data. Sequencing the virus genome information has helped track outbreaks and variants of concern, and therefore has had consequences for public health policies, including border closures and vaccination strategies, of course. In addition, we have implemented national efforts to sequence the genomic information of the host, meaning the people who get infected with the virus. One important goal of such large-scale genomic undertakings is to understand why people are affected so differently by the disease, COVID-19. We know some individuals are asymptomatic, while others suffer life-threatening complications or even die. So studying the host genome will provide an understanding of the disease mechanisms and will aid in the development of risk predictors and novel treatment strategies. So by that understanding, data sharing and secure access to genomic data have proved essential to mitigating the spread of virus and understanding the disease it causes. While genomics and large-scale data sharing has helped monitor and control COVID-19, ethical and social issues must be considered, such as equitable access, privacy, legal and ethical frameworks, public trust, and interoperability of the data, which has been a huge challenge for all of us who are working with the data coming out of the projects. So through today's discussion, the panel will share their vision on how to foster a robust data ecosystem that addresses these considerations and more. We will also discuss how data can be further leveraged in this pandemic and in future public health emergencies, especially from a Canadian data strategy perspective. We learn from our international colleagues and listen to what their experiences have been and what they have learned from the pandemic. So with that and without further ado, I think we'll get started. I'm just getting a message that one of our panelists is still to join or having some technical difficulties. We will start with our current panelist, and if the Jania joins, we will include her in our discussion at that point. So just a note for the other three panelists as well. So we have intentionally planned this session to be focused on a learning via discussion, talking about experiences and examples of lessons learned from the past 18 months. We'll have some time at the end for question and answer session from the audience. I would encourage the audience to add their questions in the chat, in the Q&A, live Q&A chat box as we go along. I'll try and keep an eye on it, and we'll address them as we go along. I have a couple of colleagues who will help me try and keep a track of those questions. To start off the discussion, given that genomic data has the potential of informing public health policy, I would like to ask each of the panelists to provide their point of view of what some of the key elements in terms of policy, governance or legal framework that allows or even ensures the use of sharing of the genomic data. I would request you if you can provide an example of how you've seen the impact of genomic data that has already helped public policy in the current pandemic. So why don't we start with Sue? Sue, just a polite reminder that you have 5 or 6 minutes for your opening remarks.
Okay, thank you very much, and I'm really delighted to join you all today, and hopefully you can hear me okay. So I think just so people get the context, I've been working on our national COVID-19 program since February 2020, and I actually started a month before that when we stood up some of the testing, PCR testing for COVID-19 within the NHS, but then went into the national program. And indeed, it's a very apposite question you're asking me, because just before I came on to this panel discussion, I was actually signing off a submission to go up to our Secretary of State about our genomic sequencing capacity as we go forward to the end of this year and through to March 2020. What has that data enabled us to do in terms of public policy and strategy? Well, one, it's enabled us to understand what capacity we've actually needed to fit with demand and the different demand models in terms of the incidence of the disease within the population, and where we see that going in terms of the modelling, both over this winter and into March 22, and over the past sort of nearly 24 months now. But really importantly, what it's enabled us to do is to set our levels of priority for sequencing, and particularly what levels we would want to sequence all of our positive isolates, and by that I mean our viable possible isolates. At one point, especially when we were seeing a lot of circulating variants, a lot of change, then that level was at 50% of all viable positives. It's been recently at 10%. It's just changing on the basis of the review of the genomic data to 20%. And so that's what we're basing our surveillance level at. What the data has enabled us to do is to really set our border control policies. And that's right the way through to everything that we've done around border control, right back to who would provide the sequencing, what would we expect of those sequencing providers, and how would that sequencing data enter into the other databases that are available from publicly funded sequencing. And then the final thing that our study, our data enables us to do is to provide a regular weekly sit rep of the position relating to our variants for each part of the country, for any outbreaks, and as part of our funded research projects. So this enables us to really understand whether we've got the right coverage, whether indeed we've tackled the outbreaks for public health action in a timely manner, and how any of that needs to be changed. What it's also enabled us to do in the final part is, when we were seeing changes, and particular more dynamic changes in either variants of concern or variants of unknown significance, it enabled us to think about our testing strategy and to establish a policy that enabled us to introduce genotyping for known mutations associated with the known circulating variants, and the availability of those genotyping assays commercially. And to do that for both our community testing and our testing for the health system. But also, when we were thinking about, and then for those samples to also go on to be sequenced, so we could look at concordance, and this was really driven by needing early availability of data to inform public health action. But when we reduced our surveillance level of sequencing, it enabled us to use genotyping in conjunction with sequencing to get a greater coverage across the population for an assessment of circulating variants within the population. So I'm just going to stop there because there's a lot more I could say, but that's just my opening remarks.
Thank you so much. So, and as you said, the data enabling to monitor surveillance across the country, different part of the country, just shows how powerful the use of genomic data could be if we used appropriately. Moving on to our next panelist, I think I'll ask the same question to you, Jan, next. Again, some of the key elements of key elements in terms of policy and governance that allows us or ensures the use of sharing of genomic data. Do you have an example that you can provide in the last 18 months or so? So over to you, Jan.
Right. As a policy scientist, more than a genome scientist, I think the previous answer was really a good illustration of what we can use all that genomic data for. I mean, and I won't say much more on that. I will say that it is so important in a pandemic where the virus is constantly evolving to be able to use genomic to understand its evolution and to understand also if some new variants are going to develop that can affect people that have already been vaccinated, but that would still be at risk for those new variants of developing severe illnesses. This is an example that really speaks about how important genomics can be to be much more preemptive than responsive to the virus and to the pandemic. But on the policy front, so what do we need to do to be able to share this genomic data and be able to do that surveillance and research work that is so necessary? In a country like ours, what I've learned is that, Canada is a very large country. It's a large country with a diverse population, multiple stakeholders, system. And all of this is extremely difficult to mobilize effectively in a short lapse of time. So the next time around, we shouldn't have to start it all over again. We need to build on solid foundations. And what that means, it means we have to come to an agreement between all the major players on the importance of data sharing and the fact that, it is as important as sequencing in using data for public health. We also need to engage the various constituents of our population. We know that we have some groups of our population who, for very good reason, are less likely to want to participate in genetic testing and to provide their samples and data. We need to understand better where the problems lie and where the solutions are. And so we need to develop also approaches and policies in conjunction together with these groups under their leadership to be able to include them in the pool of data that we're going to have so that our findings are going to be generally applicable to the Canadian population and not just to the main subset. So these are some of the things that need to be done. And there's so many tools that needs to be in place for the data sharing to happen smoothly. Things like informed consents that have to be ready. And I know you saw that, Naveed, in the OSEEK part of CanCOGEN, how useful it is to have already template that you can submit to your patient and that are going to be conducive to broad data sharing after that. So these are the kind of tools that are going to be needed. Data sharing agreement, data access committee needs to be formed. All these pieces need to be in place.
Thank you, Jan. That indeed, I mean, what stuck with me when you were speaking was that Canada is a large country diverse and a complicated data sharing ecosystem. Absolutely. We always say that the healthcare system here is funded federally and administered provincially, makes it even more complicated. I always, when I moved from the UK years ago to Canada, I always felt like dealing in the Canadian ecosystem was as if I was dealing within the European union system, and that was before Brexit. So so it's very complicated, and multiple policies, multiple rules. So Jan touched a little bit about on the Cancogen and the host-seq side. I think if it would be a good idea to go to Carolina next. I worked with Carolina in the last few months, previously as well, but on Cancogen in the last few months, and we've closely seen some of the challenges that have come through and some of the policy implications, especially on the viral side, that have come through Cancogen onto the public policy. So Carolina, same question to you. What are some of the main elements that are required or allow us to do this sharing, and maybe an example or a case study of what you saw that maybe worked?
Yeah, thank you, Naveed, and a real pleasure to be here with with Sue, with Jan, with Kenya. Is really, I think, a powerful panel and a great opportunity to discuss a topic that is really close to my heart. As you mentioned, Naveed, in the last 18 months, we have been working with the initiative called Cancogen, the Canadian COVID Genomics Network, that has two components. There were, the initiative was allocated at $40 million funding, $20 million for the viral side, sequencing the virus to sequence 150,000 viral genomes, and $20 million to sequence the human genomes, host-seq, sequencing 10,000 human genomes. So I think if we think about the learnings in terms of specifically about data sharing, I think with all the challenges that this pandemic has bring to us globally, I think there are some positive, learnings, really positive learnings. First, I think the pandemic and the fact that we're using genomics at an international level, not only in Canada, to track the virus, to track the variants, is basically helping us take genomics out of the lab. Now people are talking about genomics in the news, they're talking about genomics everywhere, and they're understanding how important genomics is to track the variants, to follow those variants. With these investments for Cancogen, we have been able to really increase the capacity. On the viral side, we now have built capacity for sequencing and bioinformatics capacity in labs across the country, in public health labs across Canada, in the different provinces. So, and as you mentioned, of course, now we are able to generate that data. We have generated actually more than 280,000 genomes, which means that we are sequencing around 15% of all positive cases in Canada, which is totally unprecedented. It's absolutely just incredible to see how we were able to ramp up the capacity to just create all this capacity across the country and knowledge and generate that data. Sharing the data has been a challenge. As Jan mentioned, there is a lot of learnings there. We are sharing some of our data with international databases. We put together data portal for Canada, VirusSeq for the viral sequences, and lots of learning also on the host side, on the human side that we're working with Naveed. We have 3 sequencing centers for the host side, and we are just in a federated model, really a Canadian model, which is the data stays in their sites and we just connect the data and make it accessible to users and researchers and potentially private sector companies that want to use that data. So what is, in terms of policy, I think we have seen incredible examples in Canada on how we can use that data, the genomic data, to inform public health and policy decisions. We actually have seen examples at a provincial level where the data has been used to make decisions about border closure. So closing the borders with the US, that big decision made in actually 2020, is one decision that was made using genomic data as one of the data points that was taken into account for that important decision. The genomic data has been used also to make decisions about lockdowns, about travel restrictions. So again, important decisions during this pandemic in terms of policy, in terms of just public health and controlling the pandemic. Genomics has been critical. As Sue mentioned, of course, genomics is helping us track and trace the variants, understand how they are spread across Canada. So we are working close together with the National Microbiology Lab, with the Public Health Agency of Canada, to put all that data together and get a clear map of where those variants are located, how they're moving across the country, how they're having an impact in the different communities. We still have work to do in terms of the data sharing to be much more timely and proactive in our data sharing, but we're setting the stage. I think COVID and the pandemic has really helped us set up this stage, and as Jan mentioned, also figure out what are the barriers, how can we address those barriers. And we clearly see that some of those barriers in some cases are technical, our capacity in some cases could be the informed consent, in particular for the human side. But in many cases also they are cultural, that were not used, and we have not set the standards to share the data. So I think, again, COVID has been a great example to help us push this envelope and advance towards that data sharing. And two more things about Cancogen that I think are important is that it's also helping us create more collaborative, or coordination and collaboration at the center of everything. So it's not, we figure that it's not just the need for funding or the need to have the equipment, the capacity, and the infrastructure, but it's the need to collaborate and the need to coordinate those efforts. So again, with Cancogen, we have been able to advance that, but it's clearly a lesson that for the future use of genomics, collaboration and coordinations are critical. So I think with that, Naveed, illustrating the virus and the host, I think those two, and maybe the last point is that we are also actively connecting virus and host, which is a big challenge. You will think that it's simple. Of course, if I got the sequence of the virus that infected me and I got the sequence of my human genome, it will be just easy to put the two dots together and try to figure out if this variant of the virus with this variant of my genome is the one making me more sick. Well, that's not as trivial. And, scientists across the world in the UK and the US are having challenges with that. With Cancogen, we are in a unique position because we are having the two initiatives under the same umbrella, coordinated by Genome Canada, and working together. So we are trying to use that advantage to try and make those connections.
Perfect. Thank you very much, Carolina. And indeed, COVID really has provided an opportunity to take genomics out of the lab, for example, for border closure information, but has really created a lot of collaborations and connections. That's in the last 18 months has really fast-tracked some of the connections and collaboration and the will for people across the country, across the world, to connect and to share information wherever they can. Maybe policies have been sometimes difficult to deal with, but the will of people has been just absolutely amazing. Again, shows humans are humans and they really want to help each other. So the human race, it's really the human race against the virus, to be honest. So thank you for that. Okay, so we'll go to Genia next. Genia, thank you. I know so there was some technical difficulties, but you're here with us. I'm so glad. Maybe for Genia's advantage, I would just repeat a little bit of what question I was asking all our panelists. And Genia, that was in terms of talking about some of the key elements in terms of legal frameworks or policies that allows or ensures the use of or sharing of genomic data, especially in terms of an example or a case study you've seen in the last 18 months through COVID. So what have you seen and what's your point of view or open remarks on those? Over to you, Jenny.
Thank you very much. Confirming that you can hear me?
Yes, we can.
Perfect. So what I wanted to share a little bit about is the work that the World Economic Forum does with the Access to COVID-19 Tools Accelerator, or ACT-A, which is a global collaboration that was formed in the early days of the pandemic at the very international level to work on vaccines, therapeutics, and diagnostics, and the resource mobilization and the equity concerns around all three of those pillars of response to the pandemic. And diagnostics, of course, was the first one really out the gate, because that testing was the front line. Almost really the only thing we had at our disposal in the early days to understand who was infected, how things were changing, to be able to understand and calibrate response mechanisms, and also in order to be able to deal with some of these health and safety questions. The border control crossings, I know, Sue, you talked about the UK, and we also saw the UK in really, I would say, be an exemplar when it came to testing and pulling that data into response mechanisms. Globally, that was quite a patchy picture. And so within the ACT Accelerator, while we were working on thinking through vaccines and the COVAX mechanism, which is under ACT-A, and then some of the therapeutics like the antivirals, we were full on really on diagnostics. So what we saw when it comes to genomics and sequencing there is that having access to the kind of data that's coming from sequencing is critical for innovation in not only within the development of the vaccines and some of the therapeutics, but really the testing capacity. And so it was interesting to observe over the course of the last 18 months or so how sequencing and genomic information suddenly dawned upon, I guess you could say, the broader global community, the policymaker community, in ways that I don't think we've ever seen before, for sure, in terms of what's the need for this capacity globally. And what has been happening now is that resource mobilization is very much on everyone's radar around how to build this sequencing capacity and where it should be located and what kind of sequencing is best fit for purpose in the various scenarios that countries are finding themselves in. So, of course, there's an inventory process going on to look at where sequencing capacity exists around the world, on the African continent, in Southeast Asia, and in Latin America, and to understand what gaps need to be plugged for us to be able to collect the kind of information that you've all been talking about. I know it seems hard within the context of Canada or the UK, but it's even harder in a lot of these other places in the world. And then feeding that information back into public health responses and innovation cycles. So within the ACT Accelerator, WHO and Rockefeller Foundation they have a working group where they're looking at what are the right needs when it comes to sequencing, and looking at, I think there's questions, to be honest. I know we're kind of all genomics junkies here, and we see the value and the power of this, but there are a lot of questions in education that need to be done on the part of donors and on the part of policymakers about how do you translate, if I'm going to invest in sequencing capacity and collecting all this genomic information on the virus, on variants, on pathogens, on the metadata that has to come with it about the populations from which the information is coming. How does it translate to things that will stop a pandemic? And I personally am hearing lots of questions about that. What are outcome measurements that we need to be thinking about if we're going to pour money into building out technical capacity, workforce capacity, informatics platforms? How does that translate into what I would say donors and resources want to see when they are making choices about where to put their resources right now? Whether they should be prioritizing the procurement of vaccines, if they should be building out vaccine manufacturing capability. So I think we have a lot of work to do to explain the inner linkages between being able to collect this information and putting that into public health response measures and innovation cycles. And that the technical aspects of it are one thing. It's hard to fund policymaking advances, as you guys all know, right? Like buy machines is pretty easy to say, but then all of the ecosystem of things that have to happen for once you've procured machines, what has to take place. So helping to unpack that, in addition to being able to answer these questions of how do these investments actually translate into stopping a pandemic in its tracks, or being able to deal with one that may be emerging. That's what I'm hearing on the global level. Thank you.
Much, Jenny, that was brilliant, and absolutely the need for capacity building, or the understanding or the realization of capacity, need for capacity or capacity building, has been a challenge, a huge challenge in Canada as well. And CanCoGen, led by Catalina, has really played a critical role in enabling some of those capacity building, especially at the provincial health labs on the viral side. So it's been a huge challenge. Okay, thank you very much for the panelists. I'm going to have a quick look if there are any questions. If not, I have a little bit of a follow-up before we move on too far further. Sue, you mentioned a little bit about the surveillance level being at 10% and kind of being very active in changing those levels. Catalina talked about we're sequencing right now at about 15%, which is amazing. But Sue, from the UK perspective, what are some of the key data points or elements that you look at where you can then say, okay, we need to now change or increase or decrease our surveillance levels? I think it will be useful for the audience to get their head around and understand a little bit how some of those decisions are made.
So of course, some of this is dependent on the sequencing capacity. And I think just before I get to that point, obviously the UK government has invested heavily in its genomics sequencing programme that I have responsibility for. So we're talking about several hundreds of millions of pounds here in this context. But of course, part of this is how can you expand your sequencing capacity to give you enough capacity per week. And so some of the constraints have been the availability of capacity. And we're currently running at about 70,000 genome sequences a week. We're planning to be at about 95 to 100,000 a week by the end of December. So quite considerable amounts, but stepping up the capacity comes with a number of constraints, especially trying to get the throughput and the quality. And the quality for uploading on GISAID, and we're at about 1.3 million genome sequences that we've uploaded to GISAID so far. So a major contributor, or the second largest contributor to those globally shared sequences. So part of the challenge has been, obviously, as I said earlier, tracking the positivity rate within the population, then the available capacity, but also modelling using sort of work linked to academics to model the emergence of the variants in the population that has been associated with transition events and with events that have led to people that have been hospitalized and essentially having very severe COVID, or impacting, for example, on people needing to be off work or not being able to attend school, or all of those things. So it's multifactorial in terms of the final decision, but our decision to scale it down was because we didn't have enough capacity that linked with our positivity rate. And if you look at the data that, John Hopkins and other organizations actually compile, you can see that we've had quite a high positivity rate in terms of the rest of the world, but our positivity rate is going down. And we're able to increase to 20%, or it could be even higher, because our positivity rate is coming down with the, a relatively small number now of variants. We've got a predominant variant in the population. We've had quite active controls at the borders. We've been using lateral flow devices, for that early infectiousness, but things have changed in terms of the positivity rate within the population. So it's all of those factors, and stepping up to doing circa sort of 95,000 to 100,000 a week in terms of sequencing. What comes with that is a lot of issues around, the generation of samples that are suitable for sequencing don't lead to needing for repeat sequencing that is able to be put through our sequencing machines without problems relating to low volumes to meet all the quality requirements. So it's getting all of those balances right and making those decisions. And we've had priority setting. We did this quite early on. Our National Health Service samples are always that are in our priority 1 category. All of our borders samples, our red border samples, and all of our research studies. That includes, the research study that has looked at both human genome sequencing alongside viral sequencing. And then we've got different orders of priorities below that, depending on our available capacity. So that's what's really driven it. But we've always prioritized outbreaks and clusters so that we can also take more rapid action. And what we're doing at the moment is we're currently changing also our sequencing delivery model, so that we will be bringing our sequencing more on a regional basis, so that we can do that much more quickly and get the turnaround time at the right time for quite early public health intervention. So that's part of, our whole strategy here.
Perfect. Thank you, Sue. Kalina, I was going to come to you next for you to kind of chime in on this from the Canadian context, especially a really nice segue when Sue talked about regional sequencing, and Canada is anything, everything and regions. So what's your kind of, you want to chime in on that from the Canadian perspective?
Yeah,
I'll go to Jenia next. After you, I'll go to Jenia next to get some wider perspective as well.
Absolutely. Thanks, Naveed. And following up on Sue's comment and making a little bit of a parallel between the UK and Canada, what Co-UK did for COVID genomics, what we are doing at Cancogen for COVID genomics. As Sue explained, the UK initiated their sequencing more centralized. So they were able to generate sequences very, very fast and share them also very fast. They have a very large amount of sequences in GZ, as Sue mentioned. Our approach was different. Like, we wanted from the get-go to build that capacity directly in the provincial health labs, which we believe, is helping us prepare Canada for future pandemics, because now we have that expertise in the provincial labs. We have the infrastructure, we have the learnings, the capacity, and we have set up or we are trying to set up the system to share the data across those public health labs and across Canada. So again, a whole different approach, being more decentralized on the viral side and being a little bit more centralized, I will say, on the host or the human, because we have the 3 CGen nodes that are generating those complex human sequences in 3 hubs across Canada. I will say for us, when we think about the advantages, is really that, again, we build that capacity, we're decentralized, we're creating, that capacity already, and we kind of went over the barriers of creating that capacity during the pandemic. The challenges is that, of course, the data sharing for us has been slow, and sometimes we just say that we, instead of working in one country, we're working in 13 different countries when we think about the provinces and the territories, because each of them has a different regulation on how they share the data, when they want to share the data, when they can share the data. So that has been definitely a big learning and a challenge, and a barrier that, together with Jan and others, we're trying to overcome and working very, very actively. The other aspect I wanted to touch, and I think that will give also Genia, a link well with Genia, is the equity, diversity, and inclusion that is really a challenge. And the World Health Organization has said many, many times in terms of the vaccines that we are not safe until we are all safe. So meaning we need to be all vaccinated, of course, to be all safe. And I will say the same for genomics. The same goes for genomics. We want to track, and we are using genomics to track this virus across the world. But we cannot track the virus if only a handful of countries are able to do the sequencing. If only a handful of countries are able to get the capacity. And even, we have heard that there, in some countries in Africa and Latin America, they're building that capacity. They're investing. They're really going beyond their means to make those investments in genomics. But in some cases, the supply chain, the availability of consumables and reagents is not there, because all the big countries like UK, Canada, the US are sequencing and maybe getting to those reagents first are, so there are many, many global challenges. And again, the virus sees no borders. The virus is moving freely across the planet. And yet we're treating the data in silos, and we're treating our capacity also in silos. This country sequences, this country doesn't sequence. When we look at the data that we have today in GSET, only about 1% of that data is coming from Africa and Latin America. That is a challenge. And where I think Canada has also an opportunity to step up and play a more active role on the global stage in genomics and lead in a more proactive way. A little bit like, the UK is trying to support Africa, the US with, as Genia mentioned, the Bill and Melinda Gates, the Rockefeller Foundation, even the Chen Zuckerberg, they're working on protocols, sharing protocols, and developing a whole system to share protocols and best practices and standardization tools for genomics. So I think, again, is a role. We have an opportunity here, and I'll let Genia, because I'm sure she has much more comments on this, but we have a unique opportunity to show the power of genomics at a global level, not just country by country.
Thank you, Carolina. And yes, thank you for setting Genia's comments for us. Genia, just if we pick up from there, capacity building, some of the developed countries, we talked about the challenges, but what about the rest of the world from a World Economic Forum point of view? How do we facilitate, and what roles can these countries play in some of these challenges, and what are some of those challenges in other countries where capacity building is not just it's a dollar question, it's operational, it's availability of resources. It's not just, you can't just throw a bunch of money at it and fix it. So what's your point of view on that?
So this is such an interesting space, because we have at the World Economic Forum a large private sector constituency of companies in the diagnostics and the therapeutics, the vaccine space. And so what we are doing on our side is looking at creative ways in which we can set the table, as we are a neutral convener that brings industry together with public figures, with academia, international organizations, civil society organizations. So how can we set the table to have conversations about what is needed by institutions, by countries, when it comes to capacity building for preparing for the next pandemic. And the sequencing question, the data questions are huge and incredibly thorny. And but so are all the ones about where are you going to get your workforce from? You know, how are you going to get all of the reagents, the assets that you need to be able to run a sequencing program that is actually linked into your public health system and also into innovation cycles. So the private sector for us is a critical component of that. But that's so tricky because the sort of prevailing narrative that's often out there is this data, sequence data, other related data are incredibly valuable for those innovation processes. And so there's a tendency, I think, to sit back and say, well, wait a minute, you know, I don't want to give up this information if it is going to lead to advances in treatments or tools that would help my populations, but then I have to buy them back from you if I just gave you the information with which to create it. So that is the crux of a lot of the conversations that the World Economic Forum has been involved in when we're trying to figure out what are constructive ways to bring the private sector to this space, because they are in large respects interested in contributing to building up capacity, and they have resources that can complement resources that are coming from other places. But those trust questions and those mechanisms by which the private sector can interact with institutions that may not necessarily feel like trusting them, that is the thorny place in which we are spending a lot of time thinking through. I can talk a little bit later, I think, about some of the work we're doing around federated data systems. You guys already mentioned it, I think, within the context of Canada, the UK. Not a new concept for some countries, but across the broader global landscape, this approach is very, it's attractive, but complicated is what we're finding. So happy to unpack, some of that we're working through with the private sector, with governments, with organizations like Africa CDC as they're working through the pathogen genomics initiative. So thank you.
Sure. Thank you so much, Yagan. We'll go to that in a second when we start talking about some of the, like, looking forward, looking at the future in a second. Before we go there, just on the capacity building and policy side, Jan, again, as I said, it's not as simple as just providing more dollar value, or we heard from Jenny and from Carolina and Sue that there are challenges around, various challenges. But in terms of policy and existing policy or change required in policy, specifically target towards capacity building, what do you see as some of the challenges beyond just the infrastructure and ability challenge? What are some of the barriers in terms of policy and regulations that you have come across?
I think that one thing that would be key and truly interesting, especially in a country like ours, where there's really a gap between building capacity and seeing the result of that capacity in terms of sequence of data shared with the metadata. I think we need policy that will tie in the capacity building with the data sharing. So, if we spend X amount on building capacity, we need to see something in terms of data sharing, some very concrete milestone that are designated in exchange of that. And I think that's something that we have to be a little bit more firm at accomplishing. We can ask about data sharing plans for the various labs that are involved in this. We can, as I said, set concrete milestone in terms of what types of data, what type of key metadata we want to see included with the data, timelines, etc. So I think that's something that will need to be set in place in our policies, and more imputability labs that receive this funding. Because again, I think we've done a fantastic job at building capacity in Canada, and that was the first step in the trajectory here. But I think we need to make sure that as this is increasing, the culture is also changing towards a culture that is much more open about what can be done with genomic data. And also where we can act like a block, like a solid and collaborative block, rather than multiple units all sort of pulling their end of the carpet. So these are some suggestions in terms of policy.
Perfect. Thank you so much. Thank you so much, Jan. So why don't we change gears a little bit and try and discuss with a more forward-looking lens. And we have about 35 minutes. I'm keeping an eye on audience questions, so we're good there. But let's focus on kind of forward and looking forward, and talk a little bit about the impact of the lessons learned. We touched on various places, but the impact of the lessons learned on this pandemic, from this pandemic, on a future public health policies, right? So most importantly, when we consider looking forward, what are one or two critical challenges that still remain to be solved and informed in terms of effective and informed policy implementation? That we've kind of learned from this pandemic, and we've learned well, but there are some challenges we talked about. So with a forward-looking lens, we'll go to Sue first, I suppose. With the forward-looking lens, Sue, what are some of the things that we have learned and we've done well? And what are one or two challenges we still really need to, they're critical to solve for us to be able to deal with something like this more efficiently in the future?
So just before I answer that question, the one thing I think we do have to tackle in terms of now with COVID-19 sequencing is the quality of the sequencing outcomes. Because if you look in GISAID, what you will see is the quality of the sequences within GISAID varies. And so there's no doubt about it. We do need to establish data standards. We need to, the ideal would be to agree a minimum data set that includes vaccination status, antibody status, you know, whether people, where people are on an infection cycle. And by that, I mean, is it their first infection? Is it a reinfection? You know, what is happening along that journey? And how, and one of the things we are learning from studies like genomic is how we do need to look at the human genome, particularly in people who've been severely affected by COVID, for potential therapeutic targets. And then we need to understand, you know, what influence those antivirals or any other therapies may have on you know, future response to future infection. And I think one of our challenges across the world will be, how can we bring some of the data that we're all holding in our different systems together to answer some really big questions about host response to pathogens such as SARS-CoV-2, because there will be a SARS-CoV-3 around the corner, who knows when, but you know, there will be another one. And this is our real opportunity, I think, to better bring together the host with the pathogen. What I would say in the UK that this is driving, it's definitely driving a discussion about data controller and data processor, especially when you have sequencing done by providers that are outside of the public system. And then some, you know, the data sort of the databases that we need for public health purposes and to really drive individuals, the action for individuals, versus trusted research environments that is available for, you know, data sharing across the world. But at the moment, our focus is on, and just today I was having this conversation about how we use the data infrastructure that's been established and put into place at speed right from the ability to tag the sample at the individual level, right the way through to where the variant is detected, or through the system, which is a challenge, and through the analytical platforms that need to be able to respond at scale and be resilient. How can we actually scale an informatics and analytical platform that can apply for multiple pathogens, recognizes there are differences in sizes in those pathogens, but how can we build something that enables us to expand and enhance our pathogen genomic sequencing, and, for example, enable us to expand our level of flu surveillance? For example, we had our last flu pandemic in 2009. What we know is there will be one soon. What do we do from what we've learned from this pandemic to set the surveillance levels for other respiratory pathogens, for other pathogens affecting other parts of the body, and what can we do to establish the equivalent of the hurricane warning system for future pandemic preparedness, and use sequencing to help us track variants and track variants across the world in a way that we probably need to do in a defined number of pathogens, and that's the work that we're going into now. But I still don't think, I think globally we could come together better to describe and determine the big research questions that enable us to be more responsive for that future pandemic. And it's bringing all the organisations that you've heard so far that are all interested in this space and all with an interest. And also, one of the things I think I've said to you, though, is that, antimicrobial resistance could be our next pandemic. So what is it that we need to do, and how can we be prepared for this? Get going forward.
Correct. Thank you, Sue. Wise words. In terms of the data standards, absolutely, Sue. I agree. We saw, and I'm more involved in the host side of sequencing, and we saw that trying to get consistent and more standardized clinical data along with the genomic data for each of the sample has been a challenge and has required some attention, because again, just the genomic data for a person doesn't mean anything unless you have the clinical data superimposed on that. And as Catalina was saying, ideally the viral data superimposed on that to really help and really kind of reap the power of the genomic data. So Catalina, I'll go to you next. Maybe, what are some of the, or maybe one or two of the challenges critical challenges we still need to solve when you look back 18 months? And then what are the things that we've done effectively that will help us deal with anything in the future, a future pandemic, whether that's AMR or it's another respiratory virus, or as they say, it's not when, it's not if, it's about when, right? So.
Yeah, thanks, Naveed. So I think one big challenge ahead of us that links a little bit to the AMR concept that Sue was bringing is the concept of One Health. We are not now clearly seeing that it's not just about our human health. We are interacting with the environment, with animals, and we can pick up those viruses from many, many different places. And genomics really has the power. And what we're doing actually at Genome Canada with a cross-sectorial approach, where we have the application of genomics for in the agri-food sector, in the environment, in human health, is really at the core of what the concept of One Health is. And so bringing genomics to that concept of One Health and looking in a holistic manner, these interactions between the virus, the human, the animal, environment, I think that will be critical for the future. And I think that's where many countries, including Canada, are looking ahead. And that One Health approach includes AMR, antimicrobial resistance, which is also where we can, use, of course, genomics to monitor those superbugs and those bacteria that will be resistant to antibiotics. And when, and have, as we were saying, I like that hurricane warning system with genomics. Actually, this is what, we should get to that level. And we actually, I think one of the good things of this pandemic is that now some of the labs across Canada that have built this important capacity to sequence and do genomic surveillance, and when they have maybe a lower number of cases, they're now able to use that capacity to do surveillance for other pathogens and start looking at other, salmonella, HIV, tuberculosis, all the pathogens, and have that understanding of what's happening in terms of those pathogens in Canada. So one big thing is One Health. The other one, I think, a big lesson for us where we have, started, baby steps, and I think we're progressing. But for Canada is data sharing, and Jan, I think, can talk more about that. But data sharing will be critical at a national level and at an international level. It's not just us sharing between provinces, but it's also sharing at an international level, as Sue was mentioning. And that goes along with collaboration. And I think for genomics and for any science and technology to advance, I think collaboration is critical. And we saw it with the vaccines. We saw how we build with years of research that has been done across the world on mRNA to be able to deploy and, develop and deploy those vaccines so fast. Same with genomics. I think we have a unique opportunity now in terms of collaboration. And I think Canada, we have invested a lot in genomics in the past 20 years through Genome Canada and other organizations. But the key turning point now is to be able to bring all that together and collaborate and have a united strategy. And that's a little bit what, I think the UK, where their UK leadership lies, is, of course, big funding, great people like Sue leading initiatives, but also the fact that, they're creating these ecosystems, they're collaborating. It's not perfect. They have many, many challenges, but they are collaborating and bringing that as a unique ecosystem. That's what we need to do with Canada. That's what we are hoping to push forward with our mission-driven approach with Genome Canada. And last but not least, the EDI, the equity, diversity, and inclusion component. I think equity has been the biggest challenge underlying this pandemic. When we think about vaccines, when we think about genomics, and we have an opportunity to change that. We have an opportunity to look at the future in a different way and bring equity. I really dream of a Canada where we could have the access to genomic technologies for indigenous populations, much streamlined, much faster. And we can do that. We can do that. We just need to start working with the communities, start working and thinking more proactively about these equity challenges we have in Canada and we have across the world. So I think those will be my key three things: the One Health approach, the data sharing and collaboration, and the equity, diversity, and inclusion.
Thank you, Carolina. Absolutely. I mean, as they say, the pandemic response has been years in the making, although we had to kind of work on some aspects very quickly, but it has been years in the making. Genome Canada, 20 years of investment in Canada on genomic. CGen, last 4 years we've spent trying to be, response ready, or what we call to be in a ready state to respond to something like this, which we were able to with the help of Genome Canada and the federal government. In the UK, talking to Kenny Bailey, especially on the genomic and the critical care facilities. When you talk to Kenny, he's like, we've been working on this for 10 years. It's not that we just started at the beginning of 2020, right? So it come to fruition in 2020, but they've been working on that for 10 years. So absolutely, I think all these things have really come together, the efforts of last so many years. Okay, so let's go to Jenny before I go to Jan, because I know he has a lot to say on this, on the still having policy challenges around that. But let's go to Jenny. And so Jenny, same thing to you, a question to you as to, what are some of the challenges we still have? And then maybe it would be a good opportunity to also talk about some of the opportunities that COVID-19 has produced in terms of data sharing, federated data. You touched on it earlier as to how some of those challenges you see being addressed or being addressed right now. Maybe good time to talk about that as well. Thank you.
For bringing many different parts of the world into the space of being able to contribute the data that they're collecting, it's for me one of the most interesting and very, very difficult challenges going forward, whether it is for the current situation and trying to understand SARS-CoV-2 better, but also being able to understand the evolution of already known pathogens, and also I take the point on AMR, antimicrobial resistance, very much. Being able to spot and monitor as sequencing capacity grows, and that will happen for sure. It is happening across the world. How to not lose that data into its own silos and repositories and places where it may be sitting. That's a kind of global meta problem that we've been thinking about at the World Economic Forum with some of our partners and organizations. And so it is, I think, for us, an opportunity space to look at maybe some technical solutions, of course, to that challenge of ensuring that trusted parties, those who need to have access to the signals that are coming from the ground, can actually get that access. There are the technical issues of it. But there are, of course, all of the other issues that I was told once, it's not a technical problem, Jenya. This is really not a technical problem. This is a problem that bedevils so many other commons kinds of issues around how to trust each other, how to understand what will happen once that information starts making its way into various other institutions, particularly private sector hands. We've already seen this with influenza and the development of the influenza vaccine. What is the equity? What are the access questions that we're going to have to grapple with as countries do indeed, and I truly believe they will come to hold more and more valuable information on genomics, on clinical side of things. And so we are looking at whether we can build on some of the work around governance mechanisms for federated data systems that came from the human genomics space, and see what can be done and what can be translated into the pathogen space. And we understand that fast response to this pandemic was available because we've got the norms out there, luckily within some communities that said this has got to be out immediately. That's not a given that that's going to happen next time we start to pick up something. So the issues around how do you allow control and security around valuable data, but also let the right people access it and ask questions of it, I think is really critical. So we're doing a feasibility study right now, particularly understanding what the role of the private sector would be in generating some of that data, but also getting access to that data. And the feasibility study is really designed to ask, in what conditions would federation really work? With what use cases? With what kind of trusted users accessing that information? And to really jump on top of organizations already building for federations. And this is, again, I go back to friends and colleagues of ours who are working within the African continent with human genomic data, but also now with pathogen genomic data, to see, can we, using very sophisticated institutions already on this journey, really prove out this model of a way to enable access, but also respect security, privacy, and the right kind of data protections that these countries are routinely now putting in place. So will that model be portable and be useful in the pathogen space? So I'll stop there, turn it back over to you, Naveed, and over to Jan.
Yes, thank you very much, Jenya. That was very insightful. So yes, over to you, Jan. In terms of policy, I feel bad asking you to tell us about one or two challenges that still remain, because there are so many. But what are your one or two top challenges that we absolutely have to address if we have to deal with a future pandemic more efficiently? And also, has there been one or two things that have pleasantly surprised you how well as a Canadians on international team we've been able to do?
Sure. I'll start by putting my GA4GH ad for a second, because Janya, I just wanted to let you know that we've actually released two quite interesting papers on data federation. There's one by Adrian Thorogood. I don't know if you've seen it. I think it was released last week. I think you'll find it very interesting. I know it was sort of the first one that sort of dealt with the opportunities, but also limitations of using data federation in such a level of sort of cases and details. So it's really a good manuscript that I was proud to be part of. Moving on to the data challenges and what can be done, what should be done now, some key things and good things that we've done. Well, I mean, good things that we've done is really, starting from literally scratch, because sadly, I mean, Canada was really not doing well in terms of data sharing at all. I mean, it was starting to develop a bad reputation internationally. Let's be frank about that. And I do think that things have improved. Of course, we're not completely out of the tunnel, far from that. But I do think that things have improved, and that the light has started, to shine, and people are starting to see really the value within the public health community of collaboration and data sharing. Some of the key rules are starting to be established. We've had some discussion. I'm sure, Navid, you've been part of some, heard about some, about, for example, acknowledgement policies. And some of these discussions have seemed a little bit tedious because they were very long, and it seemed like every time we thought we had it right, somebody would say, oh, but yet we need to do this more like that way, etc. It's really difficult to please everybody, and at the same time, it's something that's fairly succinct, internationally harmonized. So we've moved towards that, and we now have a couple of really good key policies in places. Where do we need to improve? What do we need to do? We need to have a plan for our portals. For the virus seek data portal, I think it's key that we have a plan to not let it disappear. We decided to invest in this Canadian portal. It has not yet reached its full potential in terms of allowing us to do some of the analytics that we want with the data, that will make it sort of, like a GSAID Plus portal. That was the intent. We want to continue working on that and to make it attractive to the community. We also want to find policies and develop a system of either controlled access or data federation, to convince our public health partners that we also need to share the more sensitive metadata set along with the viral sequence. We were talking about, for example, data on vaccinations, etc. So people that have been vaccinated 2 times, 3 times, etc. How can we disseminate that information, and some other, again, key clinical data along with the virus sequence? We need to have an ecosystem that's conducive to trust for the players, because right now that information is not yet circulating, and of course, data linkages, and one final point that I think, and on these things, what I want to say also, before I move on to my last point, is we need to think about having data advocates at the local level. I think that will be key, is to really develop this profession, hire these people to work in every provinces, to be able to speak on behalf of the importance of data sharing, to be also the imputable people if there are some issues with data sharing, because we've had a problem of imputability where often we saw there was a problem, we circulating from one place or another, but everybody was sort of pointing fingers at everyone. We need one person that we can speak to and say, there's a problem, it needs to be fixed, and make it smooth and simple. And finally, of course, the elephant in the room, Catalina, you spoke about indigenous population and your dream of seeing them, participate and get the benefit to the same extent as everyone else of genomic research in times of pandemic. And I'm really worried about that. I'm really worried because there I don't see the light at the end of the tunnel yet. There I see some goodwill. I think, there's goodwill on both parts, and that's great because that's essential to getting us started. But I've yet to see a solution where I can say, this convinced me, this is going to work. And that is really worrisome because it means that we haven't accomplished it this time around. And definitely this needs to be a first order of priority for the next one.
I totally agree with you, Jan. And as you said, many of us, Carolina, myself, many of us here in Canada, we've been actively involved for a long time, but especially in the last 18 months in trying to look at some of the challenges and make this happen. And lots of work still need to be done. It's on us, to be honest. I think we can do more. We should do more, and we will continue to do more on that last point. Jan, totally agree. Okay, so we have about 9 minutes or so left. I just want to make sure that I give everybody maybe a minute or two to provide some closing remarks on, again, in general, the power of genomics, how we dealt with the pandemic, what will we do going forward. So in general, at a 35,000 foot level, starting with Sue. So in your summary or closing remarks, if you wish, please.
Well, I think it's just been totally amazing, actually, the response around the world to what's been stood up and in the COVID space, especially in terms of genomic sequencing. And I think what's happened, across the world, including in developing countries, and how countries have actually helped one another. And it's been a really fantastic example of collaborative partnerships. And I think we've been trying to drive this forward in human genomics through the Global Alliance work or the Genomic Medicine Collaborative. And I think that there's a real opportunity, as I said earlier, to think about how we bring host and pathogen genomics together more in a way that we haven't done before. They have been separate, and in a way, pathogen genomics don't have the unifying bodies that have emerged, like the Global Alliance or the Genomic Medicine Collaborative, that we have for human genomics. As I said, there's a real opportunity, I think, to think much more globally about other pathogens, building on the experience that many of us have already had. But in preparing for the future, new tools, new data, new analytics, ways of, for example, applying artificial intelligence, but to really focus on how we can look at emerging technology in a different way, how we can actually evolve our public health or clinical policies in a way that means it's responsive, how we can start to address inequalities in our systems, but also how we can use this to perhaps even have a refresh about the way in which public health and sort of the equivalent of clinical health, so hospital-based medicine, can come together in a different way. We just had a lessons learned workshop yesterday for a couple of hours, and what we recognized is there's still a number of innovation constraints, and there's still, uncertainty about where we'll be in 22, 23. But we've got an opportunity if we plan, and we can plan what we need to do for the future together. We can do something that's totally amazing and take our public along with us, because they now not know what PCR means. They know what genomic variants means and genomic sequencing. And we need to take that not just into, their understanding of pathogens, but we need to take that and use it to help us drive forward the public dialogue around human genomics as well.
Brilliant. Thank you, Sue. Carolina, why don't you go next?
Yeah, thank you. So yeah, I totally agree with the points raised by Sue. One thing that we are bringing genomics global, and we're bringing this concept of One Health that I think is critical. And I think it's the cross-sectorial aspect that is really important for us to bring forward with genomics. I really like the story I heard, a few days ago, or some days ago, where this CBC journalist was asking people on the street, what is the word that you learned during the pandemic? Tell me one word that you learned during this pandemic. And there were people saying genomics. Imagine that. So genomics is out in the street now. People are talking about genomics. People are learning about genomics. People are excited about genomics. Genomics is not this kind of science fiction there that you can, modify babies. No, it's the tool that is helping you track the variants. The Delta variant, you're worried every day. Well, genomics is helping you with that. It's helping you understand. So I think it's really taking science and technology to another level. It's really helping us put this, back into our real life. And as I always say, taking genomics out of the lab. So I think that's a critical component.
Thank you, Kat.
I will bring also, again, the equity. I think it should be really critical. And on the data sharing, I think we need to be more straightforward. We need to be bold and straightforward. Without data sharing, there is no real advancement of genomics.
Perfect. Thank you, Carolina. Jenia, we have 3.5 minutes. So you and Jan, Jenia, go ahead.
We'll split it. All right. So my reflections are on the role of the private sector and the growth industry that is genomics. I think human genomics has been an exceptionally busy space when it comes to exploration, and the term personalized or precision medicine has driven so much, I think, of what we have seen in terms of investments coming into building capacity in this space. So the marriage between research and commercialization is a really interesting space. It continues to be very, very hot. And so I know that that's putting pressure on the desire to diversify the sources of information, the sources of genomics. And that's wonderful, but that also comes with a lot of, I would say, naivete and risk that is introduced by entities going into places and trying to work with them in ways that in the long term may not help the community establish those levels of trust and mechanisms for data sharing. So I'm optimistic that we have a lot of really great work to do with the private sector community, but I also want to continue to urge some words of caution there. I think this is a growth space for sure, and we have a lot of room to maneuver here to get it right.
Thank you, Jenia. Jan, a minute to you.
So genomics is now in public eyes, and I think it's a great thing. But also, I think we're going to learn as genomic scientists, as researcher, clinicians, that with this visibility comes new responsibility towards the public, because that also means that the public's it's not going to be easy to fool. It means that if we make mistakes, we're going to have to own up to them. And I actually think this can work in our favor in terms of data sharing, because I actually think, and it's been demonstrated by most studies, that when you ask them the question, would you like your data to be shared? And you explain how it works, what's the benefit of doing this, what are some of the risks, and we agree that they're rather low, even though they do exist. The people are always in favor of data sharing and of broad data sharing as well. So I think that they're our best advocate, and I think that if we can go to the population, engage them in this sort of debate, and by population I really mean all our diversity of population and communities, and really engage them in this debate, they will become some of our best partners. And I think that's really what we want to do for the next steps of this process.
Perfect.
Leave you
Thank
back
you
to
so
the
much.
science.
Thank you so much, Ian. With all the wise words, I have nothing more to add to that. It's been absolutely brilliant, apart from the fact to thank all of you, all the people for tuning in. This has been a very exciting and very engaging discussion. Thank you for all of your time. I know you've been very, very busy lately, so I thank you for your time. And have a great rest of the day and a great rest of the conference for the panels that you're tuning into. Thank you very much.